a whole. And what I would like to say to you is that at this time you are listening to Dr. Shabina Asad Qayyum. We are broadcasting live from Salaam Radio Studios. I'd encourage you to join me, and you could text me on 07745 278 978, or the studio telephone number is 01733 602 133. And as usual, we are on Facebook Live. So my very esteemed, prestigious guest today is none other than an expert in the area of gastroenterology, which entails mainly to the digestive system, as we've given you a couple of shows on the digestive system and how it works, and also the liver. So it's all one and all. It's all one and all a system. And the esteemed guest today is an expert in this field. He's a very prestigious personality in the field of medicine. He's many other qualities and awards to his name, so we are very fortunate to have him. And it's an honor to host Dr. Ishfaq Ahmed, who is a consultant gastroenterologist at the Worcester Acute NHS Trust. He's also an examiner at the Royal College of Physicians, has also been an ex-clinical director for Worcester Colorectal Cancer Services. And he's also, actually, listeners, involved in a lot of extensive community work. And one of his really good works that he is involved is in, he runs also a free matrimonial service for Muslim professionals, as well as he's embarking and has also embarked upon health awareness programs, in which he's recorded several programs on YouTube on various health topics in Urdu and English. So actually, if you search for his name, you will be able to see on YouTube that he's hosted various health topics in programs in Urdu and both English. And he also imparts and undertakes education and training for overseas students in Pakistan for every 4 to 5 days every year. So he goes out there as well to try and reinforce their training too, to the best standards. He's also been awarded the Physician of the Year 2015 from the Association of Pakistani Physicians and Surgeons UK. He was Doctor of the Year, actually a finalist in 2016 at the Worcester NHS Trust, and has also been awarded Clinical Excellence Awards Level 5 within the NHS. Assalamu alaikum, Dr. Ishfaq Ahmed.
Wa alaikum assalam. Thank you very much for your kind introduction.
Not a problem at all. In fact, I was wondering that you're probably saying, when is she actually going to get me onto the show? She's talking so much. Thank you very much for your valuable time today, Dr. Ishfaq. How are you?
I'm fine. I'm just landed home after a busy day of work.
I can imagine, as you do in the NHS, you must have a very, very hectic schedule indeed.
Yes, I think we might be interrupted if there is any emergency call.
Okay.
So only for minutes.
Okay, no worries at all. We will try to keep the listeners obviously intrigued, and we will try to keep them involved as possible. It would be wonderful if all of you could take your time to listen to this very pertinent topic. And our topic today, about which we have an expert talking about in this field, Dr. Ishfaq Ahmed, is hepatitis. And hepatitis, Dr. Ishfaq, would you like to tell our listeners a little bit about hepatitis and what it is? In fact, sort of a just baseline introduction, please.
Right, okay. I mean, hepatitis literally hepa mean liver.
Yes.
And itis mean inflammation. So whenever there is an inflammation of the liver due to any reason, so that is called hepatitis. But this inflammation could be due to various things, various conditions. And the commonest in the Western world is due to obesity, what we call is a fatty liver, due to excess of fat in the liver. So that's the commonest cause of hepatitis, followed by alcohol in Western country. And then at number 3, there is a viral hepatitis, which hopefully we'll be focusing more on today.
Okay, that's great. So basically it's inflammation of the liver, listeners, hepatitis, and as Dr. Ishfaq Ahmed has said, that it occurs due to inflammation of the liver and sometimes due to fatty liver. So is this basically due to diet, Dr. Ishfaq, that you have fatty deposits? Because I have a lot of patients that come with what you call raised ALT levels, and then you send them off for an ultrasound scan, and you see on the ultrasound scan that they have a very hyperechoic area which is pertaining to fat on the liver. And a lot of people ask me, how has this happened? Is it because of excessive fat in the diet?
I think it's related to their dietary habits and also to their weight as well. I mean, if the person's weight is above normal, so the excess of fat, like it is deposited in various parts of the body, it can also deposit in the liver. So when the fat is deposited in the liver, so it causes some inflammation. So that inflammation then gives rise to abnormal liver function tests, which you were mentioning earlier, the raised ALT. And subsequently, the ultrasound scan can confirm that there is a hyperechoic or very bright liver due to excess of fat in the liver. And that simply basically is diet related. And the mainstay of the treatment of that condition, which is very commonest, and I think 50% of hepatitis is associated with fatty liver. And it's basically it can be improved with the lifestyle.
Okay.
What we're talking about, taking a low-calorie diet, low-fat diet, and then losing some weight.
Okay.
When we lose some weight, so the fat from the liver actually mobilizes and it's burnt, the liver enzymes comes back to normal.
Okay.
So if that fatty liver keeps on going for over a period of time, we're talking about 15 to 20 years, so that can actually give rise to end-stage liver disease, what we call is cirrhosis of the liver.
Right.
So that's becoming these days is the commonest cause of liver cirrhosis. And also the fatty liver is just not an excess of fat in the liver. It's a part of the metabolic syndrome where these individuals are at high risk of developing diabetes, stroke, heart disease.
Okay.
So I think it is a warning at a very early stage when they come to you with some routine blood tests showing raised enzymes and then the liver ultrasound scan confirming that there is a fatty liver. So that's a warning sign really at that stage that if they can change their lifestyle, lose some weight, so they can actually avoid, first of all, the cirrhosis of the liver, but they can also reduce their risk of heart diseases and stroke.
Okay. Well, I think that's a really pertinent point there, Dr. Ishfaq, because the fact of the matter is I see a lot of South Asian population within my own practice, and it does seem, as you know, the percentage of diabetes within this population is significantly higher than the rest of the population. And actually, I don't think that enough stress medically from a primary care level is actually given to the fact that fatty liver is something that can definitely, if not treated adequately, may end up becoming cirrhosis of the liver. And that's a very important point that you've put forward to me, because obviously cirrhosis of the liver, for the listeners that are listening right now and engaging, means that it's actually irreversible damage of the liver. I'm correct in saying that, aren't I, Dr. Ishfaq?
Yeah, that's correct. Once the cirrhosis sets in, that means that nearly 70 to 80% of the liver is damaged. So at that point, you cannot reverse the disease process. But if you catch that condition early, I mean, majority of your patients, I'm sure, they will not have cirrhosis when they come to you.
Sure.
So at that stage, it's reversible as well. And they can also reduce the risk of developing diabetes as well, because these patients are going to develop diabetes within the next 5 to 10 years.
Right, okay. And I find that that's quite a serious thing, actually. If somebody were to come to me and say, oh, it's fatty liver, is there anything I can do for it? I usually do, yes, give them exercise advice, give them diet advice, but actually to put in this extra information that it's part of metabolic syndrome, you are at more risk, significantly high risk of developing diabetes within 5 to 10 years. And in addition to that, also the fact that, it could lead to cirrhosis if it's not addressed adequately. I think, obviously, for a lot of my colleagues in primary care who are listening right now, we do really need to take this on board and stress that it's very important that fatty liver is addressed. And a lot of that advice and a lot of treatment is actually within our hands to give to the patient. So we could avoid them from being sent to secondary care in the first place. Are there any symptoms associated with fatty liver, like abdominal pain or anything, Dr. Ishfaq?
Absolutely no symptoms at all. It's just picked up on a routine blood testing that the liver enzymes are elevated, and subsequently you're bound to do a liver ultrasound scan which will confirm the diagnosis. The only one other thing you can do is there is these days there's a special scan to see if there is a cirrhosis or not. So instead of referring to the secondary care, I think these patients can be managed in the primary care.
Okay.
With the diet, and perhaps if they are very motivated, they can be given some pills to reduce the weight as well.
Yes.
Exercise and pills.
Yeah.
And I mean, if you're worried that the patient may have a significant liver disease, there is a simple scan, what is called as a fibroscan, which basically assesses the stiffness of the liver. So that can give some indication that if there is a liver cirrhosis or not. I mean, obviously, patients with the liver cirrhosis need to be looked after in the secondary care.
Sure.
But before that, I think there is a window of maybe 5, 10, 15 years that can be managed at the primary care. So I think the awareness in the primary care, and perhaps in a lot of specialties in the secondary care, they think, oh, it's just a fatty liver. Oh,
yeah.
go home.
Okay. Well, that's quite pertinent information, Dr. Ishfaq. This fibroscan that you were talking about before we move on to the other aspects of hepatitis, is this something that's easily accessible by GPs?
It depends on availability of the scans in the various part of the county. So I'm not sure what's the situation in your area is, but I think I think if you're worried, then perhaps the best thing would be to refer the patient to the secondary care.
Okay, sure. Well, that's absolutely wonderful. And if you've just tuned in, it would be wonderful to have your participation. We've got a very special show on hepatitis, which is inflammation of the liver, as spoken by our very prestigious, esteemed guest, Dr. Ishfaq Ahmed, who is a consultant gastroenterologist at the Worcestershire Acute NHS Trust, as well as many other credentials that he has to his name. Please text and WhatsApp us on 07745 278 978, or the studio telephone number if you want to chat to us, 01733 602 133. Apart from that, you are more than welcome to participate on the show by watching the video on Facebook Live and asking the questions that you feel that you would like to, that are relevant to hepatitis. Now, this is the favorite part of hepatitis that I like talking about. It's the viral hepatitis, Dr. Ishfaq Ahmed. Could you tell us about because there are many various types, aren't there? You have A, B, C, D, and E hepatitis. So yes. Could you tell us a little bit about these hepatitises and how they are transmitted, please?
Right, okay. So I think if we take the D out, because the D only exists with the B.
Sure.
So
sure.
So easily rule that one out.
Okay.
So we're left with A, B, C, and E.
Okay.
So two of them are transmitted by eating contaminated food.
Okay.
A and E.
Right.
And B and C are transmitted through a contact with infected blood.
Right. Okay.
So B and C, they're never transmitted with the food. Okay. So I think there is a perception in our community that I've eaten that maybe takeaway or junk food. That's why I've got a hepatitis B or C. So the B and C is always transmitted through contact with contaminated blood.
Okay.
But A and E is due to if you have eaten some contaminated food, which is properly cooked, or there is contamination of the food somehow. So these are basically two separate entities altogether.
Okay.
So if we can discuss A and E first, I mean, as I mentioned, it is a food related, that by eating a contaminated food.
Sure.
And it usually causes an acute symptoms that the patients are quite unwell with it.
Okay.
They will feeling like somebody with a viral illness. They feel very unwell.
Right.
And they may develop jaundice, which is the yellowness of the skin and the eyes.
Sure.
So it's a very commonest feature of A and E.
Mm-hmm.
And what happens is that 95 to 96% of these cases are self-limiting.
Okay.
There is no treatment, and the patients get the cure on its own.
Right.
They do feel miserable for 6 to 8 weeks or maybe up to 3 months. But actually, it is they automatically get better. There's only a very tiny percentage, maybe 1 or 2%, which don't get better. That may result in a liver failure, but that is extremely rare.
Sure.
So basically, if we take that A and E out, so make sure that whenever we eat, that we eating a properly cooked food.
Yes. Okay.
it's not contaminated. And when we go abroad, particularly in our community back in Pakistan and India, so we tend to eat from the street vendors. I think that's where commonly the source of infection of A and E is.
Okay. And sorry to interrupt, Dr. Ishfaq. What I would like for our listeners is there any particular type of food that A and E can be found in? As far as I know, it's via a route you can become infected with it via the fecal-oral route. Is that right? Which means that basically it's transmitted through the fecal matter. And is that true?
That's correct. It's transmitted through the fecal matter. Somehow, if the food is contaminated with the fecal matter during the food chain somewhere, or the person who's cooking the food hasn't washed their hands properly. So after coming out of the toilet, they went straight into the cooking. So that is another possible cause. So it is obviously the virus is found in the fecal matter,
right?
And somehow that contaminates our food somehow during the processing of that food.
Okay, because you see,
so it is not the type of food you eat. So it is the contamination of the food with the fecal matter.
I see. And you see an awful lot of people coming back from Pakistan, or when you go to Pakistan and then they say, isko yarkan ho gaya, in terms of, he's had jaundice or something. Have you seen any incidences of hepatitis A and E within the United Kingdom per se?
The hepatitis A is very rare in the United Kingdom. It's only we suspect in somebody who's coming from holidays from abroad, particularly Southeast Asian countries.
Yeah.
Hepatitis E is on the rise because a lot of profession involved with, the plumbing, though they deal with it's not the clean water they deal with.
Yes, the sewage.
With the sewage. So hepatitis E is sort of on the rise. And also there was not much awareness among the specialists as well that there could be hepatitis E in this country. But that is on the rise, but the A is very rare.
I see. And in terms of living over here as well, have you ever seen any cases in the United Kingdom of people contracting hepatitis A or E through going to restaurants, for example, and the level of sort of the food hygiene? I know that every restaurant has a food hygiene rating, but have you ever seen any cases of people reporting to have eaten at restaurants and then becoming unwell as a result of it? Have you seen that scenario?
That's correct. We have seen that scenario several times. So actually the patient can sue the restaurant for damages.
Okay, so that's something to be very clear about. And if we have any restaurant owners listening to it, that's why, and I'm sure that you all pay exceptional heed, especially within Peterborough, to the hygiene of your food, etc. But it's very important to be aware that washing of the hands, I think I'm getting this message from you quite strongly, that washing of your hands after you come out of the toilet is very important before you resort to even eating food or even drinking a cup of tea, because not to forget the handles can also be contaminated as well with that. The other thing that I guess that I would like to ask is that is it a communicable disease? So there are some diseases, listeners, that are you have to inform public health. Is hepatitis E or A, once it is found to be within an area, do we have a duty of care as clinicians to inform public health about it?
Yeah, I think basically when we send the blood test to the laboratory, and if the laboratory does confirm A or E, they automatically inform the public health.
Right.
And I mean, sometimes they do carry out some investigations, but I'm not sure about what kind of investigation process which goes behind it. But these are infectious diseases and they are reported to public health.
Right. Okay. Yes, because they are. And we have, for listeners, for those that you have joined us, we are here on the Body Health and Mind Show. Dr. Shabina Asad-Kiyum, who is joined by consultant gastroenterologist in the Worcestershire NHS Trust, known as Dr. Ishfaq Ahmed. Today, our topic of discussion is hepatitis. And if you would like to ask any questions about hepatitis, or if your first language is not English and it's Urdu and you want to know a little bit about Yerkan or those conditions that cause jaundice, because obviously hepatitis isn't the only condition that causes jaundice, do send us some questions. It would be wonderful to answer your questions. We are on Facebook Live. We're more than welcome to answer any of your questions that you send us on text and WhatsApp on 07745278978, or you are more than welcome to call us on our studio telephone number on 01733 602 133. So coming back to these viral hepatitis A and E, which take place through contamination of food material. Dr. Ishfaq Ahmed, what's the treatment of these hepatitis?
There's absolutely no treatment. So again, there's a perception in our community that if I can have some kind of drip, back home there is a very potent treatment. They put a few vitamins in the drip, so the drip looks very colorful.
Yeah.
And there's a placebo effect of that drip to the majority of the patients that I had a very powerful solution injected into me. Absolutely, there is no treatment for it.
Sure.
It's a self-limiting condition, and it improves on its own. The good thing is that if we can eat plenty of fruits during that illness period, and sort of cut down on a meat and proteins a little bit, just for a period of few weeks, like a lot of juices, a lot of fruits. So that will cure this automatically in about 99% of cases. There are 1 or 2% of cases where the things do not improve. So that is where I think the secondary care need to step in.
Okay.
What we call is that those individuals are very unfortunate to develop a liver failure from this infection.
Oh, wow. Okay. So we actually can...
Extremely.
It's very, very rare. I see. And in terms of symptoms and sign, you were saying that a person feels very unwell. Are we talking about symptoms such as obviously jaundice, which is yellowing of the eyes and of the skin, and dark urine, and having pale stools? These are for those listeners who are listening in. And very achy joints. And temperature as well?
Some patients can have a low-grade temperature.
Okay. And other than that, in terms of treatment, obviously suggesting fruits, etc. You'd have to wash your fruits, though, because, yes, you don't want to be contaminated with. You have to wash your fruits as well, and wash your hands impeccably, I would say, to have a look after your hygiene. So apart from that, paracetamol to help with the joint aches and pains, just keeping hydrated.
Yeah, another perception in perhaps in the Western community and in our community as well, that the paracetamol is not safe in the liver disease.
Right, okay.
That is totally wrong. The safest painkiller, if anybody in liver disease can have, is a paracetamol. I think the paracetamol got the bad press due to overdose. From time to time you do get patients or some celebrity dying or becoming very ill due to paracetamol overdose.
Yeah.
So that is overdose when you have taken more than 25 to 30 tablets.
Oh dear.
So in a normal dose, which is 2 tablets 4 times a day, is the safest painkiller in any kind of liver disease.
Okay, that's great. And it's wonderful that we have you on the show, even though we've got 2 more minutes just till the break. But the one thing that I'd like to ask you is, I once saw I see patients, obviously, and a lot of them bring medications coming from Pakistan, especially in the form of little sachets that are supposedly supposed to be hepatic enzymes. And I believe these are all herbal. But we've got 50 seconds, obviously, to the break, and I'm going to continue this after the break. So, Dr. Ishfaq, please don't go away, because we're having such a fascinating discussion here. In fact, you are endorsing a lot of my knowledge about it that I am feeling hesitant to ask you. I'm a complete novice when it comes to hepatitis hepatitis. So hopefully my practice, inshallah, should be a lot better with it. But for those of you who are listening to the show, we have a fascinating show with Dr. Ishfaq Ahmed, consultant gastroenterologist at the Worcestershire Acute NHS Trust. He has a lot of credentials behind him. He's one of the examiners at the Royal College of Physicians, and we are talking today about hepatitis, my dear listeners. 9 seconds till the break. Please don't go away. Assalamu alaikum. We will see you after the break.
Stay tuned to Salaam Radio after this short ad break.
A child dies from hunger every 3 seconds. This Ramadan, Penny Appeal is fighting starvation through our Feed Our World campaign. We're uniting leading Muslim charities to provide emergency food aid in 30 crisis-hit countries worldwide. Just £30 will feed 30 orphans, widows, elderly or needy people. Act now. Visit pennyappeal.org or call 03000 11 11 11.
City Homes Estate Agents are your #1 independent family-owned agency in Peterborough. We offer a range of services including buying, selling, letting, mortgages and conveyancing. Why not call us today and find out for yourself why our customers return time and time again. We have a track record for achieving some of the highest prices in and around the area for our clients. With over 10 years of operating in the area, we are the experts in this market. Put us to the test today by calling 01733 348 677 and quote discount code RADIO for our exclusive rates for this promotion. City Homes, bringing people together for over 10 years.
Do you have lots of clutter at home or in the office that needs to be kept but nowhere to keep it? Ivet Self-Storage offers a secure, affordable, clean and dry home for your belongings. We have security systems in place which are monitored 24 hours a day, ensuring that your items are safe. With a simple monthly payment, Ivet Self-Storage provides secure and tailored facilities to meet your specific requirements, whether short or long term. We offer the best prices and longest opening hours in Peterborough. For more information, please call on 01733 306 456 or visit us at Ivet Way, Westwood.
You have one new message.
Please, can you call me, please, for God's sake? I'm really in trouble. Please, Allah the Wasta, call me.
This was a real message. It was left not just for us, but for you. Thousands of our brothers and sisters in the UK are crying out for your help. Don't hang up on them. Find out more and fulfill your third pillar with us. Visit nzf.org.uk. National Zakat Foundation, serving zakat payers and recipients nationwide.
Gems and jewels. Wise sayings, interesting events, and moral lessons from Islamic history. Allah's angels.
The famous and eminent companion, Abdullah ibn Salaam, radiyallahu anhu, was a righteous Jew before the coming of Islam, and in fact was a known scholar for his religion. He accepted Islam with great sincerity. The Prophet sallallahu alaihi wasallam said to him, "You have 2 rewards, one for your previous religion, and the second for this time after your acceptance of Islam." Many years later, those who were rebellious during the caliphate of Uthman radiyallahu anhu wanted to kill him. Abdullah ibn Salam said to them, "O people, do not unsheath your sword against him, for if you do, you will not put them back in their sheaths. Your leader today stands with a shield, but if you kill him, he will stand with a sword. Woe unto you! Indeed, Al-Medina is surrounded by angels, and if you kill him..."
This is Salaam Radio, Peterborough's Muslim community radio. Broadcasting on 106.2 FM and online.
Assalamu alaikum and welcome back, listeners. This is your very own Dr. Shabina Asad Qayyum for Salaam Radio, the Body, Health and Mind show. Today, on Wednesday. The time is now 7:30. Thank you very much for joining me. We have a very special show with a very special guest. We have Dr. Ishfaq Ahmed, who's a consultant gastroenterologist from the Worcestershire Acute NHS Trust. I always get tongue-tied. It's so long, I can't spell the name Worcestershire, let alone say it as well. Dr. Ishfaq, thank you very much for joining us. And for those of you who are listening to the show, because I have a question for you as well from a sister or a brother, join us on text and WhatsApp on 07745 278978 or the studio telephone number 01733 602 133. And Dr. Ishfaq, we have a question from a sister or brother. They haven't given their name, but they've got a photo of Donald Trump as their profile picture. So it should be it might be a difficult question, but we will try to answer your question, brother or sister. And the question that they have asked is, can the doctor please give us about a bit of information about bile duct cancer, which jaundice is a symptom of? How is this bile duct cancer caused, Dr. Ishfaq?
Right. I mean, the bile duct cancer is, first of all, is rare, and it's extremely difficult to diagnose.
I see.
By the time the patient becomes jaundice, it's usually fairly advanced cancer.
I see.
It's only about 20-25% of the patients are manageable to the surgical treatment. The treatment is surgery.
Okay.
For those patients where the cancer is limited to the bile duct. So basically what happens is that gallbladder actually stores the bile, and when we eat, a gallbladder contracts and pumps the bile, which comes through a pipe into the stomach. So that pipe is called bile duct.
Okay.
It's a very tiny duct. It measures in a normal person is around 4 to 6 millimeter. So it's just under half a centimeter diameter.
Okay.
So the cancer grows inside the wall of the bile duct. Nobody knows what's the cause of it, and sometimes chronic infection due to the stone. If somebody has got the gallstones and those stones have slipped into the bile duct, and they can cause chronic inflammation, that can also cause cancer of the bile duct. It's called cholangiocarcinoma, so it's rare cancer.
Okay.
And very difficult to diagnose. So obviously when the patients become jaundice, then they go through a lot of investigations, which include MRI scan, CT scan, and also there is an endoscopy procedure which we commonly do these days called ERCP, which is basically looking at the bile duct and dealing with any kind of abnormality inside the bile duct.
Okay.
So first of all, I mean, these patients will develop jaundice, and we alleviate their jaundice by putting either a plastic or metallic stent inside the bile duct to keep the bile draining. At the same time, we take a small scraping or small biopsy of the narrowing of the bile duct to see if that gives us a diagnosis. If that diagnosis is confirmed, and then the next step is that that cancer is contained inside the bile duct.
Yeah.
Usually the surgery is the treatment of the choice.
Right.
But the surgery is usually feasible in about 20% of the cases, so that 80% of the cases the surgery is not feasible.
Because of the spread, Dr. Ishfaq? Okay.
Yeah, because of the spread.
Right.
And those patients where there is a spread, they can have some chemotherapy.
I see. And is this, I'm talking about the prognosis, Dr. Ishfaq Ahmed. What prognosis means, listeners, is the chances or the outlook of the disease. When we say outlook, is it a positive outlook or a negative outlook? Just being complete layman, in layman's term for your understanding. But Dr. Ishfaq, what's the prognosis or the outlook of bile duct cancer?
Unfortunately, usually negative.
So it's poor.
In 80% of the cases, and it's only to about 20% of the cases where the prognosis is good, and those are usually dealt with the surgery.
Okay, I see. And does it usually affect people who are in the older ranges of age or younger?
It's usually in the older range, not in the younger people.
Okay, I see. Well, brother, sister, whoever of you sent that question, and I hope that's answered some of your questions. We are talking about hepatitis today, and it's a infection associated with the liver. It can be caused by various causes. Before the break, we were talking about the cause of hepatitis A and E, which are through contamination of food. And now we will be talking about hepatitis B and C, which are, I would say, a bit more serious, aren't they, than hepatitis A and E, Dr. Ishfaq? Could you tell us a bit about hepatitis B and C?
Yes, definitely. I mean, the B and C are a bit more serious in a sense that in A and E, they are self-limiting and the people or the patients get cured.
Okay.
And they become immune to that virus, those the chances of them getting that infection again are very small.
Sure.
So that one infection gives them immunity, and the body clears everything on its own. But the problem with the B and C is that in B, about 5 to 10% of patients can have a chronic infection.
Mm-hmm.
And in C, up to 80% of the cases, patients keep the virus, so the body cannot get rid of it.
Right.
So that results in what we call as a chronic viral hepatitis, that the chronic inflammation due to virus persists in those individuals for the rest of their life if they're not treated.
Wow.
So chronic inflammation then predisposes to development of end-stage liver disease, which is liver cirrhosis. Mm-hmm. And it also predisposes to formation of a cancer inside the liver.
Right.
And various other complications of the cirrhosis of the liver.
Right. So, again, quite serious. Its progression can be, it's obviously, so that type of hepatitis, listeners, stays usually with you. And how is it actually transmitted, Dr. Ishfaq Ahmed, this hepatitis B and C?
The transmission is in contact with the contaminated blood.
Okay.
So the B can be transmitted through sexual contact as well. If somebody, a female has got hepatitis B, mm-hmm. Sexual contact male can also get hepatitis B as well.
Okay.
But hepatitis C is always, in most cases, is transmitted with the blood contact, that you are coming in contact with infected blood of an individual who has got hepatitis B or C.
Okay.
So there are ways how we come in contact with the infected blood. First of all, is a blood transfusion.
Mm-hmm.
Blood transfusion, I think in UK and in the rest of the world, the blood was screened for hepatitis C from 1992.
Okay.
Because the virus was discovered in 92. Before that, we were not aware of this virus.
Mm.
So anybody who received the blood transfusion prior to 92 in UK is at risk of developing, or they may have already contracted hepatitis C from the blood transfusion.
Right.
Secondly, there were a lot of patients had blood product like platelet or hemophiliac had, those factors transfusion.
Yeah.
So majority of the patients, 50% of patients in UK developed hepatitis C from the blood transfusion prior to 92.
Okay.
But nowadays, I think every blood is screened for hepatitis B, C, and HIV. So nowadays, the chances of transmission is virtually nil.
Right. Can I ask you, Dr. Ishfaq Ahmed, it's something that's actually just purely for my knowledge. I see a lot of patients who come to me who ask me, especially the ones that go to barbershops, for example.
Yeah.
Can you contract hepatitis B through blades that are obviously not very sterile?
Yes, you can. If that blade is used on a patient
mm-hmm.
Has got hepatitis B, and then the same blade is used on another individual for the shave or cutting the hairs, so there is a risk of transmission. And similarly, I think if I can point out at this point, the body piercing and tattooing is very common these days.
Yes, yes.
And if the instruments are not cleaned properly, they're not sterile. So if the instrument has been used on a patient with hepatitis B or C, and the same instrument has been used on a normal individual without cleaning it properly. So I think there is a risk of transmission of the viral hepatitis, Hep B and C. And another issue, I think these days, these health tourism.
Yes.
The cost of treatment in UK is quite expensive. There are long waiting lists for any kind of operation, even for dental treatment.
Yes.
Patients these days are going to Far East country, they're going to Turkey, East European country for various kind of treatments.
Yeah.
So even the dental treatment, if the equipment is not properly sterile,
yes,
the patient can contract hepatitis B and C from having a dental treatment or any kind of surgical treatment abroad.
My goodness, that's very important information. And something else has just cropped up in my mind, Dr. Ishfaq. I have seen a lot of people, there's a big trend of males going to Turkey to have hair transplants because it's cheaper. Could that put them at risk of contracting hepatitis B and C, obviously, if the correct aseptic technique is not used?
If the aseptic technique is not used, then definitely they are at high risk of developing hepatitis B and C. Yeah.
Right. So a lot of you brothers who I have seen on Facebook who avidly put down that they want to go to Turkey to have their hair transplant put in, this is a word of caution. You have to make sure that this is a reputable clinic. And a lot of people will say that we're going to Turkey, we're having a holiday, and we'll come back within 2 weeks, but we'll have a whole head of hair for what, I don't know, £1,800 as compared to 5,000 UK pounds over here. This is something to be aware of, that you have to assess the cleanliness of an area. And that's very, very important, I think it is, Dr. Ishfaq Ahmed, because I actually never thought of it. Just the fact that we have been speaking about this now and this has been discussed about, actually health tourism is something that's on the rise within the United Kingdom, isn't it?
That's correct. I mean, it's rising, I think, remarkably. Even a lot of patients are going to India for their treatment, like operation, knee operation, or any kind of surgery. Or even NHS at one stage was thinking of sending the patient abroad. I think at some stage, some patient went to India or Far Eastern country for having their treatment on NHS basis.
Wow.
So I think we have to be very careful about whenever we go out or if we're planning to have any kind of treatment, including dental treatment, unless there is emergency, I would suggest not to have any kind of treatment in those countries, because you're never sure that the instrument has been properly cleaned or not. One group I think we haven't discussed is individual who shares the needle for intravenous drug abuse.
Yes, exactly.
So that's another group of patients which are very high risk of developing hepatitis B and C because they do share needles. So the same needle which has been used in somebody who has got hepatitis, if somebody else uses the same needle, I'm sure they will get hepatitis B and C infection. So I think there is a scheme in the UK that all these drug abusers are given clean needles so that they don't need to share.
Yeah, so that's obviously you have the needle exchange program in which, you get clean, sterile needles. Obviously, it's very important for us all to be aware of these serious conditions which can lead to, as Dr. Ishfaq Ahmed was saying, cirrhosis of the liver, which is irreversible damage of the liver. Once your liver's gone, it's a major organ of the body. You can't survive without it. And the other thing is cancer of the liver as well, in which there is, I think, hepatitis C. Back in my days as a medical student, I remember hepatitis C had a 50% chance of progressing onto liver cirrhosis. Am I correct in saying so? Or has the statistic come down now, the percentage come down?
Percentage is difficult to predict. I think 20 to 30% patients will develop cirrhosis.
Okay, and is the same percentage exists for hepatitis C progressing to cancer of the liver, or is it a lower percentage for hepatitis C?
Those who develop cirrhosis, in those individuals, there is another 20, 15 to 20% chance that they will develop liver cancer. We unfortunately lost a couple of friends who were doctors from liver cancer due to hepatitis C.
Oh my goodness. So it is something that needs to be taken seriously.
Yeah. I mean, they were only diagnosed when they presented with symptoms, and it was a bit too late at that point.
What are the symptoms of hepatitis B and C? Very much the same as hepatitis A and E, would you say?
Totally different. These hepatitis B and C very rarely causes any symptoms.
I see.
When the individual contracts the infection, they might feel slightly flu-like symptoms for a few days.
Okay.
But apart from that, there is absolutely vast majority of patients don't even know when they contracted hepatitis B and C. So that's the reason this is kind of what we call as a silent killer.
Right. And we have quite a lot of interest. I can see there are many people that are watching the show at the moment on Facebook Live. And if you've just joined us or in the process of watching us, we have a very prestigious guest, Dr. Ishfaq Ahmed, who's speaking to us all the way from Worcester at the moment. And he's one of the consultant gastroenterologists at the Worcestershire NHS Acute Trust. And I have a question here from a sister who hasn't given her name, Dr. Ishfaq Ahmed, and she has said that if a person was to be infected with hepatitis B or C, do they have a legal obligation to inform their partner, such as husband or wife, that they have hepatitis B or C?
It's a very difficult question. I would say yes.
Yes.
I would say yes. Because I think there are two issues. If we tackle the hepatitis B first.
Yes.
If a partner has got hepatitis B, what the usual policy is that all the household members are vaccinated against hepatitis B.
Okay, they're tested first or they're vaccinated?
They're tested first and then vaccinated.
Sure.
And that actually prevents them contracting the hepatitis B from a household member or partner.
Sure.
The situation in hepatitis C is slightly different because it's not sexually transmitted.
Sure.
And it's only when you share some sort of like toothbrush or razor blade of your partner. So that's where the chances of transmission is.
Mm-hmm.
So I think they should know that if the partner, I'm not sure whether it's a legal obligation, but I think they should inform the partner that have got either hepatitis B or C. And then another issue with hepatitis B, which we see a lot of young patients with liver failure and liver cirrhosis and liver cancer in Asian country, those who contracted hepatitis B from their mother.
Oh, okay.
So if the mother has got hepatitis B, she will invariably 100% transmit that hepatitis B infection to the baby at the time of birth.
Right.
So every woman in UK who's pregnant is screened for hepatitis B and C. And those mothers who are hepatitis B positive, so the extra precaution is taken when the baby is born. He or she is given the treatment in the form of proteins at the time of birth, and within a few months the baby is vaccinated. So you can prevent transmission of infection in 100% of the cases if the gynecologist or obstetrician knows that the mother is hepatitis B positive.
I see. It's a bit more difficult though, isn't it, if a person has contracted hepatitis B or C, as sometimes we see that there are people, especially South Asian community, who have partners who are within Pakistan, for example, or India or Bangladesh, and they've had children over there, and obviously they may have contracted hepatitis C or hepatitis B through whatever measure means, and they would have already transmitted that to the baby if they weren't tested for it. Is that correct?
If the mother is not tested for hepatitis B, I think this practice is now becoming more common in Asian countries as well, that all the mothers are screened for hepatitis B particularly. Right. Because the transmission in a C is not very rare that the mother can transfer the infection to the baby, but in a B, it's nearly 100%.
Okay. Well, that's really interesting information. And I hope, sister, that has answered your question there. I think from a communicable disease point of view, if somebody has contracted hepatitis B or C, we obviously, as clinicians, all of us have a duty of care to communicate that to public health, or to find out if the lab, like you said, depends upon which trust you're working at. They have a duty of care to inform public health. But at the same time, carriers of hepatitis B, when they have contracted hepatitis B, they do have a duty to inform their partners that they have hepatitis B. And there have been some complicated cases, which we won't go into, but I'd probably need somebody. Actually, a good idea now, Dr. Ishfaq, that you've given me, is to call in a medico-legal expert to talk about these ethical dilemmas when it comes to informing partners regarding these transmissible infections, blood-borne infections or viruses such as hepatitis, HIV, etc. So, and what legal obligations are binding upon the public to inform their loved ones too. So, sister, I hope that has answered your question as well. And moving on, in terms of pregnant women, obviously the virus can cause the placental circulation and go to the child. Is it before pregnancy or during pregnancy, or not at all?
It's at the time of birth.
I see. Okay. So
during pregnancy, throughout the pregnancy, there is no risk of transmission. So it's usually when the birth happens, so the transmission happens at that point.
Okay, that's wonderful. And moving on just a little bit, because we are approaching the end, and I wish that I had lots more time with you, Dr. Schwab. I will be calling you again, I promise, on the show for more shows, hopefully. And I wanted to talk to you a little bit about the role of interferon injections, because they are treatments that are given in chronic hepatitis. Is that correct? And when are they given?
So, I mean, these days, so every hepatitis B and C is treated. And we are at the stage that we can say safely that the hepatitis C is a curable condition.
Amazing.
The treatment has advanced so far that now we can safely say 80 to 90% of the cases we have got good treatment. Yes, there are cases which are resistant to treatment in about 10 to 15% of cases. So I think the treatment has improved. I mean, when I was training as a registrar in my first year in those days, we were treating a lot of patients with interferon, and I did an audit, and only cure rate was about 10 to 15%.
Wow.
So, but now the treatment has improved so much, we can say 80 to 90% can be cured from hepatitis C.
That's amazing. It really is.
And the issue with the interferon is that obviously there are various treatments. So the basic treatment these days, what we call the first line treatment, is interferon plus there is an antiviral drug called ribavirin.
Okay.
Combination of this is given for 6 to 12 months, depending on. There are further types of hepatitis C, 1, 2, 3, 4, 5, 6.
Okay.
So only one is dangerous. Remaining 2 to 6 are actually safer to have.
Okay.
Nothing is safer, but they are better, easily treatable.
Okay.
So the first line treatment is usually the combination of antiviral drug with injection. So the injections of interferon has improved a lot. I mean, it used to be every 2 to 3 days, but now there are sort of slow release injection which can be given once a month.
Okay.
Problem with these interferon injection is that they create a kind of flu-like illness for a few days.
Right.
So they give patients tiredness, pain, arthralgia, little bit of fever for a few days. So the patient do feel ill for a few days after having this injection. So that is the first line treatment, and within 6 to 8 weeks we can tell whether the patient is going to respond or not by checking the virus in their blood. And if the patient is not responding to the treatment, then they go on to the second line treatment, which is slightly more expensive, and there is a third line treatment as well. So the second line and third line treatment does not include interferon.
Okay. Well, Dr. Ishfaq Ahmed, I really do. You've, first of all, increased my knowledge about hepatitis. So hopefully I will be treating my patients much better and be told less off by my consultant gastroenterologist colleagues. And thirdly, thank you ever so much for your time. We've reached the end of the show. Thank you so much. And inshallah, we'll be having you in future. And thank you very, very much indeed for your expertise on this.
Thank you very much for the invitation. It was a pleasure to talk to you and to the audience today.
Thank you very much, Dr. Ishfaq. So, listeners, we hope you've benefited from all of this wonderful knowledge given to us. Don't forget to join us next week on the Body, Health and Mind Show here with your very own Dr. Shabina Asad Qayyum on Salaam Radio 106.2 FM.